The most beautiful part of medical school is the practicality, the fact that you are not just reading theories, but you're also doing what you are reading. So when do medical students start seeing patients, start consulting patients? Actually, medical students start consulting patients for the first time. Hello, my name is Jude. I'm a final year medical student living in Nigeria. In today's video, I'll be talking about my first experience consulting patients. The preclinical arm is where you learn about the normal structure and function of the human body. Then when you come over to the clinical arm, you basically learn about diseases and how they are managed. So when do medical students start seeing patients, start consulting patients? Medical students start seeing patients from the fourth year of their medical training. So how was the experience for me? Well, after writing my first medical board exam, that's anatomy, physiology, and biochemistry, I was thrilled because I was coming finally over to the clinical arm. The beauty of the clinical arm is that you are exclusively with the doctors, you are in the hospital setting, and the fact that you're actually seeing patients, real clinical cases, and you're seeing how they are being managed. The first posting we had when we came over to the clinical arm was our M0 and X0 introductory medical and surgical posting, and we did this posting at the time that we've not even done our pathology lectures, we've not had pharmacology lectures, so we're like tabula rasa. And imagine being given a patient to click when you have no knowledge of pathology or pharmacology, especially that pathology. So it was really a tug of war. The initial experiences were not very sweet. I came into the clinical that was late 2019. I started with endocrinology department or unit. So we had to start learning how to take history, though they gave us lectures. These were entirely new concepts. Before this time around, I never knew what clinical clerkship or taking history was, and the fact that it is the backbone of clinical medicine. That's one thing. Apart from knowing your pathology and pharmacology, knowing how to take a very good clinical history is like the backbone of clinical medicine, especially in the tropics. And it is not something you read from the book, it is more of an art. You need to know your pathology well, you need to understand diseases, but then even if you know your pathology very well, if you don't practice the art of taking clinical history, you may never get good at it. My experience wasn't palatable at first. The first few patients I saw or I was assigned to clerk was tug of war. Okay, the first challenges I had was this. I would go to clerk, most of the patients were not compliant, and you go to their bedside. Obviously these patients are tired, some are having financial constraints, some are obviously in pain, and a lot of things going on with them. So you come with your own wahala and ask them. I've been asked to take a clinical history from you, and especially when you start with the fact that you are a medical student, they're already tired because they want solution, they don't want wahala, they don't want anybody to disturb them. But you have to do it because you've been mandated to do it, and two, doing it is the only way you would learn. So getting most patients to even talk to you, to reply and welcome you, it was like the initial issues we had. I understood quite well why most of the patients were not receptive, because we just came to 400 level, we're collecting these patients. Most of these patients too were being collected or were being managed by our senior colleagues. Like most people from 500 level, 600 level were also collecting the same patients. So they were overwhelmed and tired. So that was why most of them were not receptive. In fact, when you come, some even pretend that they are sleeping. That was the number one issue I had with clerking. The fact that in as much as I didn't like disturbing people's peace, but I had to do it anyway. Secondly, taking clinical history from people, you had to keep asking them some questions that would invade their privacy. And even though you were not okay with it, you have to do it because as a doctor, you have to learn how to do that too. Imagine asking people their MSP history, that's their, if they had multiple sexual partners, and stuff like that. Medicine and surgery is actually a talking profession. If you're an introvert, you like being on your own, medicine will bring you out of your shell. You have to talk by force. And even after that, you have to, after taking this medical history, which of course, asking these questions, you're basically trying to arrive at the diagnosis. You're just trying to check if a particular disease condition is present in your patient using knowledge of pathology you have. Then after that, you also do a clinical exam on the patient. After doing all of this, of course you have to report your findings, and during the ward round you have to present to your consultant. You have to project, you have to talk loud. That's another part of it. And when you present to your consultant, your superiors, they would scrutinize your history, make necessary corrections, and tell you areas to improve on. You get insulted most times. Even most times they get to correct your grammatical errors too in front of everybody, and call you names in front of your patients and even in front of your colleagues. In general, my first experience was not so good. In fact, I don't think I want to remember the first patient I presented. Obviously, I was even scared because already I knew that I have not done a very good work. But I was happy I did it, because after that correction, the second one was not as bad as the first one. Emphasis is placed on clinical clerkship in the tropics because of the limited resources we have. No, we don't have all the diagnostic equipment, obviously, because they are very expensive. Most of them cost millions of dollars. And how many hospitals in Nigeria will you find this equipment? So you have to rely more on your clinical acumen to be able to diagnose your patients. That's why they placed emphasis on it for medical students to be able to take a good history and clinical examination, so that they can be able to diagnose a wide range of clinical cases from just history and examination. And also, even if these equipment were available, how many people in this part of the world will be ready to bring out the money for investigation? Because most of these investigations are very, very expensive. MRI, for instance, now is over 100,000 now, just one investigation. Imagine you have to write over 10 investigations for a patient, and the patient is a salary earner, a minimum wage earner. So we have to tell ourselves the truth. Most times our patients cannot even afford all of these things. So you have to rely more on your clinical acumen to reach a diagnosis. That will be all for today. I hope you enjoyed today's video. If you have not liked this video, please like this video and help me share it with your friends. If you are yet to subscribe, kindly subscribe so that you get notified whenever I post the content. Bye and have a lovely day.